talk about chronic stress and cortisol and its impact on PCOS. So welcome on in. Alright, it's Wednesday. Hi guys. Talking about chronic stress. I think this is going to be very relatable. Right? And we're going to get started right now. PCOS. And this is sort of piggybacking on the last session where I talked about skinny girl PCOS and lean PCOS. There's different types of this thing, right? So this is pertaining to those of us, I'm going to say us, who you're doing what you should, you're eating, or restricting your eating rather, working out, sometimes working out extra more than you normally would, and your weight isn't budging, and you still have your PCOS symptoms. So tonight we're going to get started, right? Hope everyone had a good day so far. I know I'm ready for the weekend. So the question we're answering tonight is really, can chronic stress affect your hormones? And the answer is yes, absolutely. And it really is going to be a neat discussion about cortisol and our cortisol levels. And these are the hormones that we know more familiarly as our flight or fright, our stress, right? So if you are being hunted through the forest or being chased and your body has to reach for that extra reserve, these are the hormones that kick in, your stress hormones. And the adrenaline that you need is provided. But really, the stress isn't always in the form of being hunted, or never, hopefully, in the form of being hunted and chased, but just some of the daily stress that we internalize, our mental health, all of these physical stress as well too. All of these really would amount to being chased and hunted through a forest. And that's when you need your adrenaline to kick in, your flight or fright hormones, right? So it's well known that stress can cause disruption in the menstrual cycle for women, and total loss of menstrual function. So high stress. So if you're an athlete training really hard or you're gymming really hard, your periods can get off track. Travel or stressful experience, trauma, death in the family, changing jobs. In the office, when I say this, I talk about a new boss and an old boyfriend, right? These are all reasons why some women who have this specific form of PCOS are more likely to see disruptions in their menstrual patterns and also a lot of other PCOS symptoms, right? So in general, just to kind of frame the background here, PCOS is found or known to be prevalent in 1 out of 10 women. That's the estimate based on the US. In Europe, they say 1 in 10 to 12. I'm working on the theory that it's actually 1 in 3 to 4, which is why I do all of this work regarding PCOS, because I see it a lot more commonly than the textbook says. And there's a lot of information we don't know about these conditions. So what if you're doing what you should or as best as you could and you're not seeing any results? What if you have this version of PCOS that is really not even in some of the textbooks or none of the textbooks that I would have had to study from? So all of this information is still rolling in. So the estimate is about 10% of women may have PCOS. In some communities, I'm seeing it's way more. It affects not only your fertility, but it also causes a lot of frustrating changes to a woman's physical appearance, right? So including managing your weight and your weight gain and your weight goals, male pattern hair growth, you had really clean skin in all of your teenage years, and now as an adult you're getting this really bad acne. It's expensive, it's frustrating, it's embarrassing, water retention, bloating, right? The list goes on in terms of the features. We do know there's a genetic component to PCOS, but the increased risk really comes in from your lifestyle and environmental factors. Do you exercise? So you can have 3 women all with it, and one may eat a particular way that helps with her symptoms. One may be training or exercising, and that works for hers, and the other one is not going through the same motion, so she experiences a lot more of the PCOS symptoms, right? So it's thought that about 20% of women with PCOS or even more may go undiagnosed if they're not overweight, which I touched on last week. In terms of the effect on hormones, what I'm trying to address today is, do you know what happens to your hormones on that day when you just got coffee alone? And you skipped breakfast or you skipped your meals, and that's already a stress on your system, right? And again, in the background, remember I talked about running through the forest, being chased, and your stress hormones kick in. But your run through the forest really could be that day when you've skipped breakfast, you may not have slept well, your body is unprepared for the day ahead of you, you've skipped your meals, you're running on E literally, and you're in stress mode, so your stress hormones have kicked in. And this is what I'm going to address in terms of chronic stress, chronic exposure to stress that will impact the woman's hormones gradually, and a lot of these symptoms won't be immediately apparent, and you can learn to tolerate a lot of them as well. So what happens when your body's cortisol levels are too high chronically? And also, I have mentioned this before, but there's supportive studies saying that women who have PCOS actually have an exaggerated response to stress. So you produce a lot more of the stress hormones more readily, which creates this vicious wheel. The high male hormones that cause the PCOS symptoms and features, some studies are supporting the fact that you produce these excess male hormones more in times of stress to protect your body, or your brain rather. Your brain goes into self-protection mode when you're under high stress. So you end up producing more male hormones because it has a protective effect. I kind of simplified it in my mind when I read up this information. Like, okay, so I'm under high stress and my brain says, you know what, make more testosterone. What does testosterone do, right? It gives you that ability to fight and aggression and more muscle power. So if you're being chased through a forest and you're in flight or fright mode, your brain will automatically start kicking out more testosterone, because under stress you need that extra boost that testosterone will give a woman. So I simplified it to that, and I hope that ran home with you guys. So basically, the studies have shown that high male hormones that cause the PCOS symptoms, right, the thinning of the hair, the adult acne, central obesity is the big one. With stress, it's actually excess production, because it's your body's way to protect you in a way when you're under high stress, to give you more testosterone to pull you through. So on that day when you only had coffee and you skipped on your meals and you didn't take a moment for yourself and you're just plugging through the day, you are actually producing more testosterone at that time as well too, which is not going to help anyone with their PCOS symptoms, right? So I thought that was interesting. Now, most medical doctors do agree that the most effective way to manage PCOS or polycystic ovarian syndrome is via diet, right? A lot of times I see patients, I do not write a prescription for anything. That's why the diet is important. I'm saying this to my client this morning who had McDonald's yesterday. She was honest with me. And we worked through why she ended up in McDonald's yesterday, because it really just is not the path that she is on. But it was one of those hard days for her, and really that kind of fell out of the range of the diet that she should be focusing on. And on top of that, she didn't exercise, right? So we had a good chat this morning. So we accepted to manage her symptoms, eating a low glycemic or low sugar diet. Regular exercise helps balance your blood sugar levels, and exercising regularly will improve your symptoms as well with PCOS. However, the missing ingredient to managing is stress, and that's what I want to impress on tonight, right? This ability for us to tolerate high stress, chronic stress, really is ruining or affecting your hormonal balance as well too. So tonight we're talking about how excessive stress, even stressing about your diet, about your lifestyle in general, could be driving your adrenal glands to push some of your PCOS symptoms. Now, both overweight and normal weight patients with PCOS have higher levels of cortisol. That's that flight or fright hormone I talked about. You're being chased through the forest, your body kicks into gear, cortisol. But that now shifts where weight is distributed. So you have a stress belly, you have that central weight there, thinning of the hair, your skin changes, you break out in acne when you're stressed as well too. And women with PCOS, even in lab studies, when they check their cortisol levels, they do tend to have higher levels of the stress hormone, which is important to know. The higher levels of cortisol are not optimal for your overall health, not for your fertility. You always feel like something's humming, right? There's always this background hum because you're high stress and you can't really bring it down. Cortisol disrupts the menstrual cycle. It increases your appetite. And guess what? You crave sugar. So it increases your appetite, which promotes weight gain. Your testosterone is kicking in because your body's trying to arm you to fight whatever fight you're supposed to fight, which is really just the regular day you're going through, and that you get that gut, right, that central belly fat, and then your hair thinning and so forth. So the higher levels of cortisol when you have chronic stress are problematic. Previous studies in like older, like I found from like '04 and '06 and '08, these other studies talked about this as well too. But there's really no test to say, let me go get a blood test for PCOS, which I've been asked. But it's a combination of factors, and this is one example as to why you wouldn't think that, you know, the type of day you're having is actually pushing your hormones to be even more imbalanced. So the adrenal gland, they're little tiny, like, picture like little ice caps on top of the kidneys. They sit at the top of the kidneys. We have two of them, and they're doing a lot. Like from the minute we're born, we need these glands to kick in, and it coordinates a lot of different functions in the body, including secretion of cortisol and male hormones. So the ovaries primarily make the excess testosterone issue for PCOS when we check labs and so forth. But the adrenals also produces testosterone when you're really stressed out, right? So let that sink in. So with one of the studies, they adjusted for, you know, weight that women, their body weight, and they measured and they found that with PCOS there was a 2 times or 1.9 time higher rate of increased cortisol, right? So that's the adrenal glands. Now we have two, and they sit on top of the kidneys, and they produce all of these hormones, especially your flight hormones, and the testosterone. So stress, whether it's emotional stress, right? I talked about old boyfriend, new boss, travel, competing or being really competitive, overtraining and so forth. That can be considered stress. Emotional stress, any trauma, a death in the family and so forth, financial stress. We know the list, right? This will cause your adrenal glands to release more cortisol because the primary part of our brain thinks we're being chased through a forest, right? And then this inadvertently will increase the testosterone. So in terms of the PCOS symptoms, this is not driven by insulin resistance. You do crave sugar, but you have other versions of PCOS, and this is the one where your periods stop at those times in your life, right, when you're stressed. So either you're experiencing high levels of stress or your body overreacts to stress. That's the other kicker as well, too, that we see with PCOS. So many people, you know, including a lot of colleagues in the field or doctors, they don't realize that just being overweight is not the only problem here with PCOS. Last week I talked about the skinny girl PCOS, and here we are talking about stress as well too, impacting it. So while weight loss is important, if you need to lose it, you may not have a weight loss need, and you may still be experiencing a lot of the excess male hormone symptoms, you know, the facial hair and hair loss and so forth. And a lot of my colleagues will then say, oh, well, take the pill or regulate your period with the pill and let the pill bring your period, which I do as well too sometimes. But if we get to the base problem, we may not need to expose everyone to some of the side effects of being on the pill as well too. This is important for the women who are extreme dieters, right? You do your detox and your fast and all of these things, and you're really good at being extreme. But not so good at being consistent, because how could you be consistently that drastic with your nutrition? So extreme diet and extreme exercise behavior, you have to be cautious, because that can backfire on you by stressing out your adrenals, and you start to develop adrenal PCOS. So the more extreme, you actually could be driving your male hormones via the stress pathway, right? And then cause symptoms similar to PCOS that's coming from the ovaries. So chronic stress is a major contribution to this adrenal PCOS symptoms as well too. And it's everywhere, right? As I just listed off all the different reasons. Long work weeks, poor sleep, that coffee thing that we do, and we just had coffee for the day, new babies, aging parents, and just even our mindset, right? Constant negative thoughts are a source of stress, depression and anxiety and so forth. Concerns about the physical appearance actually scored rather high in a database of women that were polled in terms of what was their source of stress, and even just paying for some of the skin treatments and so forth. So it's a vicious wheel. And then on top of that, your immune system is impacted. You get more frequent infections and UTIs and yeast infections, and the list goes on and so forth. So that extreme dieting, extreme workout, going in hard. I know Carnival is coming for all the revelers. Just be cautious, because you end up literally realizing I'm doing all of this and I still have a gut, or I'm still getting, or I'm losing some of my body weight, but my skin is not doing what I want it to do, right? So for some women, it might even drive them to restrict further when they realize that there's been a plateau. And this is the worst part of it, because, your stress drive is climbing up. Your male hormones are rising, so that then creates problems with your weight and your skin and insulin resistance and so forth. And then it's a harder struggle. So for some women, this might drive them to restrict their diet even further, or yo-yo again and try another diet and see if that one's going to work and so forth, or work out more intensely and push yourself. And it's something that, we all struggle with, but it's important now. What I'm going to get into is how we can identify it. It's an adrenal issue, and what we can adjust without going through these motions that we tend to, right? So how do you know this is you? Testing or doing a workup, blood testing is so crucial, so important with any of these conditions, because then you might just end up spinning and end up, not grasping what the core or the root problem is. So if you've ruled out that you don't have insulin resistance, again, I've talked about that. It's a quick, easy test to check, and I think as we roll through our family history and our risk and weight and so forth, a lot of us qualify for screening for insulin resistance just on body weight and all of these things. So if you've tested for that, you check the thyroid, you do some of the ovarian hormones. There's one hormone, because these things are quite expensive, especially if you're not covered by insurance. So what we land on is, okay, these are all good, this is good, nothing's wrong there. The DHES lab is one test that can tell whether this is an adrenal PCOS. I think I send that maybe 20% of the time, because by the time we've checked on the insulin, we can identify this is the type of PCOS that is the primary issue that we're dealing with. And also these shifts will range. So I could check yours today and you have some really stressful stuff happen for the rest of the year, hopefully not, and this number will shift and your symptoms will shift as well too. So that's one of the drawbacks with testing. In general, with PCOS, we still stick to the same diagnostic criteria, which is irregular periods, the ovaries on the ultrasound, the polycystic, and of course the physical features with the acne and the facial hair growth and unwanted body hair growth and hair loss, right? As the trifecta, we look at with those three things. Once we suspect that there's PCOS present and we start ruling off things, then we land on this adrenal situation to get to the root cause of it. So that can be done if you have concerns or any of this kind of rings a bell for you that this is something that is possibly impacting you. Now, it's normal for women to have some androgen or male hormones in our system, and one article was talking about why we need to probably stop calling it male hormones, because we need our testosterone, right? We get a kick of testosterone when at the time of ovulation. We need it for bowel function. We need it for libido. We need it for weight, energy, and so forth. And then low testosterone, which I'm not touching on today, just one statement about that. That's a problem as well too. If you don't have enough testosterone, low testosterone in a woman will present as a low sex drive. And I get this a question a lot about sex drive, and it's multi-layered, but lower testosterone. Now, do we go taking on testosterone? We don't. But if you don't have sufficient at any given time, that's an issue. And of course, mood disorders and loss of cognition can happen. But again, this is quite rare. Now, one of the confusion with PCOS and testosterone is the fact that the adrenal glands makes its own testosterone as well. And that's the testosterone I said that kicks in when you're very stressed and being chased through the forest, which I'm equating to an average very stressful day where you haven't eaten. So you make this bump of testosterone from the adrenal gland. So testing for that can be done. Now, in terms of if we find out that this is an issue that you're having, the main focus in treatment is to try to balance your cortisol hormone, right? So cortisol hormone, flight or fright, I'm being chased, that's kicking in, I get my adrenaline, and when it has a surge, I have the testosterone surge. So if we balance the cortisol, then we will be able to sort of work backwards on this problem that we're having, and encourage healthy hormone balance and more regular periods and so forth. So the first thing is to prioritize your sleep. Oh my God, sleep is so important. So prioritize the quantity and the quality of your sleep. The guidelines talk about 7 to 8 hours. Try to get at least 6 consistent hours. Try to work in that time frame. But sleep loss does have significant health consequences on your adrenals. You literally are not sleeping well enough for your body to feel less stressed and more relaxed, so that stress, flight or fright hormone doesn't get to come down to low levels from lack of sleep, especially with people who are prone to adrenal PCOS, where stress impacts your functioning of your ovaries. For example, sleep. Right, cortisol has a diurnal pattern to it. We need a burst of cortisol in the morning as we wake up and rise, and we're more alert and ready to attack the day. But if you haven't slept well, if you're working with high stress, you have a huge project with work, you have a boss that doesn't care about your cortisol levels, then you are losing the ability of sleep, kind of breaking that up for you to get that shift again and the rise with the next morning. So to support adrenal PCOS, you want to sleep. That was number one, right? You want to prioritize your sleep, especially pre-menstrual ladies. 7 days or so before your period, just go to bed, close the laptop, take the TV off, and go to bed, because again, that high stress situation. But you want to prioritize sleep. Aim for 8 hours, right, per night. That's when your body will heal and reset the stress hormone production. So it shuts down, powers down, and we need to power down. You can aim for 7 to 8 every night. And this in general also reduces the sleep disorders that women with PCOS are prone to, which I've spoken about. You also want to look at things like your alcohol consumption, if that's a source of stress, right? Especially close to bedtime, right? That glass of wine just before bed, maybe not so much, like let's leave that for the TV actors, right? And avoid caffeine in the afternoon. Someone in here, I think Lexi was in here when we did the July 1 coffee, and she says, oh dear, I just had my second cup for the day. But not in the afternoon, especially if you're prone to these issues, because that will throw your sleep off, right? And your sleep, as I said, is important. And a regular bedtime routine. You do it for the kids, right? It's bedtime for the kids. Why isn't it bedtime for you? So that keeping up a routine is important. Avoid these electronic, not now, but after my life, you want to avoid these electronic screens as well, too close to bedtime, right? And also my favorite supplement, but not my favorite, one of my favorites is magnesium. And every article I pulled about adrenal PCOS and chronic stress and excessive exposure to stress would also always mention magnesium glycinate, magnesium in different forms. And then whenever I tell someone to try this, try it on the weekend. Don't have a flight to catch the next morning. But magnesium is known for giving what we call restful sleep, right? So that's number one, right? You want to prioritize your sleep. We have a comment here a question from Avi. Is it typical for PCOS patient to be tested for sleep apnea? I would say that testing is not as done as commonly as it could be. I myself would test for sleep apnea any surgical procedure, or if there is different physical features of PCOS-related sleep apnea. And one quick question is, do you snore? Yeah, everybody hears me snoring, waking up tired and so forth. So we pick it up, but it's not as routine as it should be, I'll be honest with you, right? Second on the list for adrenal PCOS and how to manage it would be stress management. Oh boy. So chronic exposure to stress without relief is what I'm talking about. So this will negatively impact your adrenal function, bump your cortisol, your brain thinks you're running through, someone's chasing you, running through a forest, and then the testosterone. So simply put, you cannot just fix adrenal PCOS without actually removing or prioritizing stress management and removing the source of your stress. So you can't always change or eliminate the source of the stress. So it's important actually to figure out how you cope with your stress and how you manage stressful situations, because life is full of stress, right? So it's not even about eradicating stress from your life. Good luck with that. But how you deal with it and how you balance is important, because you really want to be able to have moments when your cortisol level is low and reset and gets a chance to go back to nothing. So when you are in a more stressful mode, you do get that surge of cortisol, but it's not a chronic exposure to it. So, I talk about yoga and exercise, right? Meditation, go for a walk in nature. These things work. Therapy if you need it. Don't shy away from that. Journaling, right? I would have a couple of clients in here who would have heard me tell them, get that journal, put your thoughts down before bed and figure it out tomorrow, whatever's rolling around in the brain and so forth. So that's important as well too. And try to incorporate at least one stress eradicating activity per day, because if your cortisol is like, it's this constant background noise of stress, you should target at some point in your day, which could be masked in the form of exercise or yoga or just lay on the floor and stretch or something, where you are allowing your cortisol to actually reset, because the chronic excess or elevated cortisol is an issue, ladies. And this is the person who is not losing that midsection, is battling that that skincare routine is not working as it should, loss of hair and so forth. Let me take a step back and see, is it that my cortisol is actually working against me and I need to eat on time and I can't exist on coffee every day, and maybe I need a new boss or a new ex. I don't know, but you understand all the stress I speak about, right? So in terms of stress management, the techniques are there to lower stress. Acupuncture is something that a lot of times people shy away from. But true story, when I worked on the delivery unit at NYU Lutheran in Brooklyn, we had an acupuncture team. I remember the ladies, they'd all come in and I used them if my patient in labor was open to it. And it worked a lot of times. Long before we called for the epidural and so forth, we'd come in and introduce the team, and they'd come in and do all these wonderful techniques. So don't shy away from the less traditional medicinal approaches. A lot of times I will talk to you in the office and you leave with the number for some service, some massage service or herbs and so forth, right? Speaking of herbs also. So I speak about magnesium, one of my favorite supplements. Anything gynae related, anything related to your reproductive organs, magnesium is a kicker there. Those PMS, those moods, those cramps, it gives restful sleep. Try it on the weekends at first though, because you don't want to oversleep, but definitely it's not a sleep aid and it's not addictive in any way. But we already know a lot of women, especially women who suffer with hormonal imbalances and moods and PMS and cramps and so forth, are usually magnesium deficient. Checking a blood test is not very useful because it's possibly going to be normal when you check it, but it's when you need it, it's when you have these dips. So about 7 days or so pre-period is when we see the magnesium drop, and that's when you're not the nicest person to be around. So again, that's one supplement. Exercise, I don't have to stress on that, right? But over exercising, I will comment on. I would have commented on, and that extreme diet, extreme exercise. You stress yourself out and then you're doing 1,000 crunches and you still have a gut, right? Because you're actually creating a pretty bad cycle for yourself. There are herbs and natural supplements that are important here that can be used. There's one ingredient that's really being looked at by the studies called resveratrol, which I think I'm pronouncing it right, which is a natural phenol, natural ingredient in some plants. And plants actually produce this if they're injured, right? So if a plant gets broken or a leaf or something, if a plant is injured, it produces this resveratrol, is the name of what they call this. Even if a plant is fighting bacteria or fungus, it's healing themselves. So this is found in the skin of grapes, blueberries or fave, right, the antioxidants, raspberries also, mulberries and peanuts. They carry this ingredient, which research is suggesting can be used to help reduce the testosterone being produced by your adrenals when you're stressed, Okay, so we have a question. Hi, thank you. So what dosage of magnesium will you recommend for women? So I recommend anywhere between 300 to 500 milligram, and it's going to be labeled on the bottle. Like mine here that I use says I have 500 milligram, which is what I found in the store, but it sometimes comes in 300. And then if you have like a blend, a multivitamin, it usually would have some magnesium in there, but definitely for the impact on that, PMS, the impact on this stress related abnormalities to your periods and so forth, you're looking at 300 to 500 milligrams. So most supplements won't have that much. So you should buy the actual separate magnesium and take it maybe an hour or two before bedtime. Try it out at first, like I said, on the weekend, because if you're really sleep deprived, this one kicks in. But 300 to 500 milligram is the answer there, right? Thank you for the question. And I see Moline Joseph is locked on. Thank you. Now, number 4 on the list is an anti-inflammatory diet. Food again, right? So the anti-inflammatory diet. The foods you eat are important for your adrenal glands. I just talked about it being compared to a stressful day. You didn't eat on time. You're really high stress your brain is interpreted that you're being chased by someone with knives, right? So the diet and the food you eat is important as well too. And I'm going to sound like a little broken record because every week I incorporate diet because it is really an important part of how you feel. But, your fruits, your veggies, like colorful diet, right? Your fruits, your veggies, your nuts, your seeds, your lean protein. And lean protein, talking to my ladies who not only have PCOS but also fibroids, right? Uterine growths, those tumors that really can destroy the natural architecture of the uterus. The lean protein is important. Whole grains. You want to actually avoid sugar fluctuations. So that day when you feel like you're being hunted through the forest is the day when your sugar is doing a lot of ups and downs because you really didn't eat on time. You just rely on this 1 cup of coffee, which is not helping with your cortisol levels, right? Because it's a natural stimulant, and then you didn't eat on time, so your sugars flop. And then because your body's like, well, we got to run through the forest, we're stressed, you actually crave, and you crave bad things, and it's sugar most times because you're supposed to be preparing for battle, but you don't. You just crash when you go home and you haven't worked out. Oh, who does this sound familiar, right? Who does this remind you of? So to prevent dramatic blood sugar fluctuations is important. Increase fiber in your diet. That helps to make you feel full longer. That helps to allow your body time to really get to digest your foods and absorb what it needs, because a lot of our nutritional deficiencies is also because we're not sitting there with the food being digested properly. You want to avoid that. And of course, the combo on your plate really should be your protein, which should be lean, your fat, which should be healthy fat, your avocado, your salmon, your olive oil, and so forth, and your complex carbohydrates, right? With your meals, that's really what your plate should look like. And there's a huge crossover also with women with abnormal periods between whether it's PCOS that's causing it or polycystic ovarian syndrome, or is it what we call hypothalamic amenorrhea, which basically is your brain is the problem causing the periods not to come. And this is the person who loses their period when they're over exercising and under eating. And it's not the traditional PCOS, but the impact that presents as irregular periods. And you can even have the ultrasound show it as well too. So in some cases, this over exercising on the eating can be misdiagnosed as lean or skinny PCOS as well, but that's where the blood testing comes in, because the huge problem is a lot of women with skinny or lean PCOS, as I said last week, need to eat carbohydrates, but with the restriction, I need to lose weight, my midsections and so forth, you restrict more and you make it worse, right? So many experts, there's no consensus. We can't agree yet that this cortisol issue needs to be checked, because the test for cortisol, it's a lot of complicated things. It's an endocrinologist to test your levels. It's done at a specific time between 8 and 9 a.m. They can check the saliva. They got to give you something first to trigger the stress and then check the levels. But we're not addressing that. What I would more so say, it's important to recognize the signs that, hey, I am not treating my body well. I'm behaving with the stress as if it's something I should be tolerating. And then my internal organs, my brain, my liver, my insulin production, my adrenals, everything's thrown off because literally I'm so stressed it feels like I'm running through a forest being chased by knives, right? So that's me in a nutshell for tonight, talking about adrenal PCOS. I hope this was helpful to you guys. I love the couple questions that we would have gotten, and I'm going to obviously post this and you can review it. I watch it myself in the mornings. I cringe a lot when I hear my voice, but I do watch myself in the mornings when I'm like making breakfast or doing my dishes or something because it's so short. But it's important to recognize that, hey, is this some of this information, is this applicable to me? Especially as I said, the adult acne, or the resistant acne that's not responding to treatment, the resistance of your weight, for all your exercise regimens that you're trying and all your diets, you're still not getting where you need to be. Try to get evaluated and let's see what's going on. But behind that, stress reduction, attention to your diet, go to bed, get some sleep, turn the screens off. The magnesium trick, please try it and give me feedback. If you buy the magnesium and you try it, leave a comment, because I practice what I preach for the most part. And I think that's a big kicker here with the adrenal type PCOS where we're so stressed out. All right. With the herbs, I kind of got sidetracked. I'm going to do a post on ashwagandha because it's information that's digestible. It's not enough to just do a whole live on ashwagandha, but I'll definitely do a few posts because that is something that the studies are confirming helps to balance our hormones if we need to be balanced, and also helps to kind of help us deal with stress and help us feel more calm as well too. And this is a plant-based herb as well, so I'll be posting on that one. But just be mindful with any herb, know the source, or at least read some reviews online. None of these are really FDA approved. And also, when you're trying a new herb, be very self-aware. Look out for any side effects or reasons that you need to stop. Okay, so that's it for tonight. I recognize a lot of the names in here. I see Avi has a comment. She said, my first visit with a new doctor asked how I was sleeping. So I love that you addressed that tonight. Yes, absolutely. And that's a big part of it as well too. Right, so thank you guys for your time as usual on a Wednesday. And I hope everyone enjoys the rest of your week. And I'm going to keep these topics rolling. I know September is PCOS Awareness Month, but my whole world is PCOS, so we're just going to keep going as usual. And you can share this with anyone that you think is struggling with some of the symptoms I would have described. Right, so thank you and have a great night.